Assalamu alaikum dear viewers, I am Professor Khalil ACP. Previously we discussed the essay Water Crisis in Pakistan which was being asked in CSS examination 2021. Today we will start with a new essay Health System in Pakistan. It was asked in 2020 in CSS examination paper, and we are going to talk about it, in what way the health system of Pakistan is in working order and what can be done in that favor, and how many departments are involved in this system just to make it better. Healthcare in Pakistan is delivered mainly through vertically managed disease specific mechanism, and it is divided into three parts: primary, secondary and tertiary. In primary, we talked about the preventive and promotive elements, and in secondary and tertiary, we talked about the curative and rehabilitative issues of the citizens of Pakistan. Two departments are working from the point of view of government. First one is National Health Vision, and that is working, and its concern is universal access to quality health services and just to improve them. And the second system here, which is in working order, is Prime Minister's National Health Program, and its motto is to access to medical care for underprivileged citizens without financial obligation. There are five departments working in that field. The first one is provincial and district health departments, and the second one is parastatal organizations. The third one is social security institutions, and the fourth one is non-governmental organization, NGOs. They are working in Pakistan too, and the fifth one is private sector. Pakistan public sector is too weak in providing the facilities to the citizen or the common people, but the private sector is too costly to deal with it. Now the problem is Pakistan is passing through a crucial situation in healthcare system, because Pakistan stands at number 154 out of 195 countries. This shows to what extent Pakistan is just dealing with this menace, and healthcare access and quality index is just getting lower and lower. That is required to be improved. Policies are made to be announced and delivered to the commoners or to the effectees. But the problem lies that policy makers are making policies, but they are totally fail conveying the benefit of those policies to the effectees. Pakistan is facing multiple health issues like infectious diseases, cardiovascular diseases, mental and child health issues, malaria, tuberculosis, dengue fever, COVID-19, dengue, cancer, HIV, hepatitis, and the most influential disease, thalassemia, and many others. Pakistan are hard-working people, but the problem lies where they are not properly informed about the diseases they are coping with, and bit by bit they just cross all the stages, and when they enter into a hospital, they are informed that their problem has crossed all the limits, and because of those diseases which are too common and easily be grabbed at the very first place, but it becomes a cause of their death, and it disturbs every one of us because Pakistan has no diagnostic system. It needs to be moved on and to prove it to what extent we can just grab the disease at the primary level, and then we just seize that disease to increase here in Pakistan. Just like in dengue fever, most of the people they get involved in it, and premature measures they were not taken properly. If they were taken at the right time, then that disease can be seized from the beginning. Cardiological departments, they are not available in the rural areas, and the availability of those centers is not fulfilling the requirements of the people who don't have an access just to touch the private sector. That's why they always died right there at their homes, because most of the hospitals, they just say so that we are not properly facilitated. You should move on from here to the bigger cities. Primary level diseases just like high blood pressure and high blood cholesterol occur due to the use of low quality oil and ghee. But there is no proper stoppage in the system of preparing the proper oil which is usable for us and health worthy for us too. Public sector is failed to deal with the health issue of Pakistan. Insufficient paramedic staff, nurses, unhygienic condition of hospitals, non-availability of doctors is common everywhere in the hospitals. One side, facilities are not available, and on the other side, concerned employees don't participate heartily in their working positions.